Chris, thanks. It is, of course, Labor Day weekend. For a lot of kids, if they're not there already, they are thinking one thing, back to school. Here in New York City, 1 in 10 people, though, have contracted the H1N1 virus, or swine flu as it's commonly known, which has a lot of people worried about back to school. Mayor Bloomberg announced free vaccinations for all elementary school students in New York once they become available this fall. But in the meantime, government health officials are saying the virus really will affect young adults and children at higher rates than the seasonal flu, making schools a breeding ground for infection. Here's CBS News correspondent Hattie Kaufman.
Less than 2 weeks into the school year, hundreds of desks are empty at Nevada Union High School near Sacramento.
Yesterday, I was just notified by our nurses in our attendance office that we had 300 kids out. And I wasn't real surprised. We had anticipated, the flu going through.
Most absent kids complain of high fever, aches, and congestion, all signs of H1N1.
But there's the kids are out for a lot of other things as well. So they have colds, they have allergies, they have other stuff. But obviously the H1N1 is here, and people are dealing with it.
People are being affected more so.
Cindy Gallagher is a registered nurse whose son Cody has been out a week with flu-like symptoms. She says the outbreak is no surprise.
When kids get in school, they share drinks, they share bites off their sandwiches or bites off candy bars, and they're not real good about hand washing.
Yesterday alone, 24 schools were closed nationwide. With the school year just beginning, health officials caution more outbreaks are sure to come. Hattie Kaufman, CBS News, Los Angeles.
Now, the H1N1 virus isn't just a problem for schools. More than 2,000 cases of swine flu has been reported at colleges and universities since classes began a few weeks ago. Take a look at this map we've put together for you. Nearly 300 cases reported in Pennsylvania, 283 in Georgia, 223 in Washington, just a little bit more than that in Missouri. North Carolina ringing in with 165 cases, 147 in Colorado. You can see Texas and Florida have also been affected. So here to give us a good idea on how we can protect our kids when they go back to school, whether they're in college or elementary school, Dr. Alana Levine back with us today. Great to have you here.
Thank you.
In some ways, I guess colleges, I think back to when I was in school in mono. You know, there'd always be a cluster of mono. So when you have kids living in close quarters in a dorm, it seems to make sense. But are schools, you think, being proactive enough and taking the right steps when there are outbreaks there?
I think they're beginning to, because as we know, this is a very contagious virus. And like you said, in close quarters like dorms or common eating areas, bathrooms, those are places where the virus can spread. So I think it's important that the schools sort of have a plan. So if children do get sick, they need to separate them from everybody else who's healthy, and that will maximize the number of people who stay well and can continue to go to school.
Which a lot of schools have been doing, and they've even, I know some of them are handing out sort of swine flu kits with hand sanitizer when kids get there. When it comes to elementary schools, though, we just heard Hattie mentioning that high school in California, 300 students out. Not necessarily all of them had the flu, but some of them are staying home. Is it still kids and young adults who are most at risk?
Well, the CDC actually published a report earlier this week that looked at the deaths from swine flu, and they found that actually the majority of them, 80%, were in children older than age 5, which is different from what we've seen previously from seasonal flu. But I would sort of keep that with a grain of salt. Thankfully, we've only seen about 36 deaths that they were able to look at in the study, so maybe as the numbers increase, those statistics will change. But what is clear is that children with underlying medical conditions, whether it be a respiratory condition or a neurologic condition, are definitely more at risk.
Well, that's what I was going to say, because some of those children who did die did have something else going on, which is important to point out. If there is an outbreak, should you automatically keep your child at home, even if they don't have any symptoms?
I don't think so. I mean, I think that we need to keep kids in school learning. We need to keep parents in the workforce. But I think that we need to be smart about things, and there are a number of things that we can do. One is teach your children how to wash their hands properly and frequently. Much more frequently than they ordinarily would.
Okay.
Second of all, we need to vaccinate children, both for seasonal flu and for H1N1 when that vaccine becomes available. Exactly. Okay. And we need to keep kids home when they are sick and keep our kids away from other children who are feeling sick.
And that vaccine is the swine flu vaccine, the flu vaccine is available now in some areas.
Right.
Swine flu is not until October, but you could probably call your doctor to make an appointment for that.
Exactly.
Right? All right, some great tips this morning, allaying some of the fears, which is important as we head in, because there are plenty of other things to worry about for kids at school, right? Dr. Alana Levine, thanks.